The Family Health Care Foundation helps families in Hillsborough, Pinellas, Polk, or Pasco counties find and enroll in health care options that meet their needs. They can also connect families and individuals with resources that can help them stay healthy or receive appropriate care when needed. They're up next on Bayside. Good morning and welcome to Bayside. I'm your host, Shelley Sanders. We're talking all about Family Health Care Foundation. And to do that, we're talking to the Executive Director, Melanie Hall. Welcome back to the show.
Thank you. It's nice to be here again.
Yeah. You know, it's one of those things that is so necessary. We kind of just put it in the back of our minds and kind of forget about it. But then when it comes down to the moment where you have to make these decisions and figure things out, you go, so you wish you had somebody. Everybody wishes they had a Melanie to talk to. So we're doing that today.
Great.
It's always so informative whenever you get here, just to kind of explain the ins and outs of things. And it's nice to know that there's a foundation out there that can explain those things and be there for the people, especially the people that have questions about it or need help with all of that. So without further ado, I know I kind of alluded to it a little bit. Talk to me about where the Family Health Care Foundation steps up to play and how it relates to Kid Care, Florida Kid Care.
Sure. Actually, we are an organization that is grant funded, so we don't work basically getting any sort of incentives to sell insurance. So we are here to provide very objective information for families that are looking for affordable options. So we're able to work with families to look at Florida Kid Care for their children, at the marketplace options or the county health care options for adults, and then any other kind of free or charitable clinic services that families might qualify for. So we're here really to connect families with needed care.
And how do people know you exist? I mean, outside of like us telling our viewers today, how do they know that to go to you? Is this something that they might come across and maybe in the healthcare system somehow, or where are they how are they locating you?
So
to
we
get
have
these answers.
Exactly. We have great partners out in the community, including St. Joseph's Children's Hospital, the Children's Board of Hillsborough County, the school systems. Provide a lot of referrals back to us. So we've been around for 17 years now, and as a result, people really have identified us as being that connector. And we do get from a variety of sources some, referrals that are really help create that that lifeline and connection for families to the care that they need, either for themselves or for their children.
Sure. Now, speaking of children, speaking of through the school systems, let's talk about these kids. There's no reason why any child in the state of Florida should go without health insurance. That's just the bottom line. I mean, no reason for it whatsoever, especially when we've done such a fantastic job of making sure our youngsters are taken care of. So without further ado, let's talk about that. Florida Kid Care. I'm sure that if there's anyone out there, there aren't very many that haven't at least heard of Florida Kid Care. What exactly is it? And is it a completely free insurance? Just explain and walk us through that.
Sure. Florida Kid Care is actually made up of 4 different programs. The one that most people might be most familiar with is Medicaid for Children, and that is a completely free program, both in terms of there are no monthly premiums, there are no copays, no deductibles. And that's for children up to about 133% of the federal poverty level. So the Medicaid expansion that didn't happen for adults did happen for children. So
That's
more children,
to know.
it is, more children qualify for that free coverage than ever before. So that's certainly the largest percentage of children in Florida Kid Care, and it is free. And so there are still plenty of children out there that would qualify for that free care that don't know about it. Then there are 2 other programs that are considered subsidized programs. which means from 133 to 200% of federal poverty level, those families can qualify for $15 or $20 a month for all of the children in their family.
So 1 to 14 children.
Exactly. You pay $15 or $20 a month depending on your income, and as a result, they then have access with no deductibles to very reasonable copays, like $5 or $10. Some services for no copay at all. So that's again a very affordable option. And then if even above the 200%, there is a full pay option that families can buy into that is a very pediatric specific network. So for those families that are looking for really good, robust coverage for their child that may have a special health care need, for example, or the final program in Florida Kid Care is Children's Medical Service, which is a network that's very specific for complex children or chronic care children who really need a multitude of specialists and therapies, and it does a great job of helping coordinate all of that care for those children.
Well, I'm really glad you broke it down that way. Number one, because there is that, I think you said, between 133% to 200% above poverty level. It's that sort of, that little section of that demographic, if you will, that maybe they're the ones that are sitting there thinking, you know, I have 6 children. There's no way I can afford that, even if it's $15 or $20 a month. But it's not per child. It is for all 6 of your children. If it's just the one, or if it's, you know, however many you have. That's important to know, because I think that, you know, it's so often, it's sort of like the tell the secret game, where by the time it gets back around, it's not really the secret changed so many times, you know what I mean?
Correct.
Whereas they may hear that $15 or $20 copay amount or monthly amount, and they're assuming right out of the gate that that's for each child, when in fact it isn't. So bottom line here is that no matter where you fall, Florida Kid Care is going to work with you.
Correct.
Figure out where you are and what your needs are. So now let's talk about that coverage. Talk about the providers, because I think another misconception is that people tend to think, well, because it's Florida Kid Care, or because I am on a discounted monthly amount, or because I fall in this, because I am on Medicaid, whatever the case, the because, they tend to, maybe there's a misconception out there that, hey, well, I'm not going to get as good of service. I'm not going to have the provider listing that, say, someone else has.
So sure. One of the real advantages of Florida Kid Care is that you get to choose your provider network. So what we always encourage families to do is to call their pediatrician or whatever provider that they're really attached to, they want to make sure they keep, to call them and find out which of the either Medicaid or Florida Kid Care providers they accept. They almost always accept at least one, sometimes multiple programs. And so what families are able to do is choose that provider that actually gives them access to the doctors that they would like to stay with and continue a relationship with.
Sure.
That's really important for families who have, you know, complex children and want to make sure that that care is continuous for their child.
Absolutely. So that basically there's a choice here, and in more ways than one. All right, I'm sure you still have questions, and that's fair enough. There's the website you're going to look up. That's going to give you all the information that Melanie and I are talking about today, and then some, familyhealthcarefdn.org. Why don't you check it out while we take a short break? Welcome back to Bayside. I'm your host, Shelley Sanders. We've been talking with Melanie Hall all about family health care, the Family Health Care Foundation, and of course, Florida Kid Care is included in that. Just talking about our children and getting them insured. And again, to reiterate the fact that if you have children in Florida and they're uninsured, it's completely unnecessary. There are options out there for you, and that extends across the board. Like when we left out on break, we were talking about the options on who your provider is. We aren't talking about, okay, it's this doctor only and that's it. So with that being said, let's talk about some of those benefits. So you've got the options of which provider you would like to use, and that's so important, especially when you're talking about children that have special health care concerns, anything, I mean, it runs the gamut. So let's talk about the benefits. What are we looking at in terms of that? What's included?
Basically, checkups to transplants are included. Wow. It's a very robust benefits package, and it's very specific to the health needs of children. So all of the primary and preventive care is included, so immunizations, well child checks, developmental screenings, those are all included. But then all of the sick child care, as well as any sort of chronic disease management is included, plus dental, if a child needs eyeglasses, if a child needs a hearing aid, all of those kinds of services that really helps children keep up with their peers and be well prepared for school and successful in life. Sure. So it's a very well-rounded benefits package, and again, co-pays are very low for those services for the subsidized program or free under the Medicaid program. Sure. So it gives great access to care for children.
That's huge, the fact that dental and eye care is included in that. I mean, those are two of the typical pieces of your overall health that aren't included in health insurance. You don't usually see that. It's like a separate dental policy at the very least. They might cover an eye exam and then the rest, forget about it. So that's huge. Lots of benefits, and it sounds like an amazing insurance plan, no matter which category of the 4 areas that you fall under beneath Florida Kid Care. So let's talk about eligibility. So I know we kind of briefly talked about it in terms of income levels, but who's eligible for this?
So any child in Florida who's legally residing, so they don't necessarily have to be a citizen, they just have to be legally residing in the state of Florida. There is no longer a 5-year wait for immigrant children. That was eliminated a year ago. So we have a lot of newly eligible families now for Florida Kid Care. And from 0 up to the 19th birthday. So it also does extend longer than many people realize.
Wow.
And it's within those income brackets that we talked about, 0 up to 200% for free or subsidized. And above that, people can buy in. But a good example, because I think many people tend to think that that's a very low-income program, a family of 4 can make up to about $50,000 and still qualify for that $20 payment.
Wow.
Exactly. So even if you have a single parent who has 3 children, all 3 of those children can be covered for $20 a month when that parent is making $50,000 or less.
Wow.
So it's a very broad program, more broad, I think, than many parents realize.
That's a lot broader than I would imagine most people would realize, parents or non-parents at all. I mean, I would have guessed that number to be quite a bit lower, considering our average income in the Bay Area is below that number.
Correct.
So that's pretty astounding. And again, the benefits are amazing. So just to stress to you again, in case you didn't get it the first couple of times I said it, if you have a child, there's no reason why your child should not be insured in the state of Florida with Florida Kid Care. I mean, this is a fantastic program. So how do you go about applying? Say that we're talking to somebody right now and they're ready. Oh my gosh, I'm just now hearing this. I'm new to the state. How do I go about doing that? What are the steps they need to take, Melanie?
So Florida Healthy Kids has a website, healthykids.org, where someone can go onto that website, and if they're comfortable navigating a website and doing an electronic application.
Do you have a link on your website?
We do.
Family Healthcare Foundation. That's the one that you're looking at right now, familyhealthcarefdn.org. The website Melanie's referring to, there is a link there, and of course you can always call them because that's what they do. They are a resource for you to help you, to get you steered in the right direction, so you can always give them a shout, log onto their website, and they'll show you how to get to the website you're referring to.
Correct, and that's what I was going to say. There are plenty of families that can navigate doing an application by themselves, But there are also many families that really appreciate that one-on-one assistance, and that's what we are here for. So we can sit down with a family, we can help them go through the application, we can help them submit whatever documents they might need to verify their income or citizenship, and as a result, we can really help shepherd folks through the process and make sure that they cross the finish line and actually have their child end up being insured and having access to the services they need.
Sure. And again, like you said earlier, you don't have to be, if the child is not a citizen, I would imagine we might even see some of that after the effects of Irma down in the islands. Maybe some of those children becoming citizens or at least residents of the state. All right, so much to talk about. Log on to familyhealthcarefdn.org. Check it out. We'll have a link for you on ours as well. Got to take a break. We'll be back. Welcome back to Bayside. I'm your host, Shelley Sanders. I've been speaking with Melanie Hall all about Family Health Care Foundation. And of course, today we've been talking all about Florida Kid Care. Really, I'm going to tell you again, and you're going to hear me say it again after this as well. If you have a child that's not insured and you are a resident here, not necessarily a citizen, if you're a resident, there's no reason why your child should not be insured. Melanie, do you have an idea? I mean, are there a lot of children out there that aren't insured? I can't imagine why, but that are residents?
There are. So in the Tampa Bay area, there's approximately 19,000 children who are eligible for these programs and still uninsured. And actually, we have great data on where these kids are. So we're really working with school districts and community-based partners to reach out to families in those particular zip codes that have the highest percentage of children that are uninsured. However, really all of the zip codes in our area certainly can benefit from this information, and we're happy to help anyone that continues to contact us and really needs assistance through this process.
Wow, that's an astounding number. 19,000 students, children in the viewing area. Quite possibly even someone sitting there watching the show today. How do we get to them? How do they know that they can go and get this? Is it just a matter of like, let's just talk about it? And perhaps there are people out there, maybe teachers that are watching the show. Or is this a person that we could talk to? Is this a group of people that we could speak to, like our educators? Hey, by the way, talk to the kids that are at school, talk to those families, get to know these students, find out if they have insurance. Let them know that there's information.
So we have a great partnership with our school districts, in particular with the school health personnel, as well as the school social workers. And we do get a lot of referrals from our school partners. But I think that one of the ways that parents tell us they hear about these programs often is from other parents. And that also has a lot of credibility to it as well. When you hear from another family that they're really happy with the coverage that they have and that it's affordable and that they have access to good doctors, that carries a lot of weight with families. So I would suggest that anybody that does have this coverage speak to their friends and neighbors. It's a great way to get this information out.
Absolutely. So you heard Melanie, talk to your friends and neighbors, talk to your play dates, parents, find out and just share the word. Now, what do you say to the parent that says, you know what, really and truly, my kid is so healthy, why? I really can't find the money in there, so we're good.
So a couple
Do you have
of things.
apathetic parents?
Not usually, to be honest with you. Once parents actually understand this opportunity, typically they're very interested. However, there are certainly some people that are a little more hesitant, and kids are accident prone.
Sure.
Kids get sick. Kids go to the hospital occasionally.
Right.
And so we really want to make sure that when those services are needed, they're covered, as well as having access to preventive care, which is so important for kids to make sure that they stay healthy. Very
important. I once heard a broken arm can cost up to $10,000. can set you back. All right, familyhealthcarefdn.org. That's the website that's going to give you all the information that Melanie and I talked about, and then some today. All right, we're taking a short break, but we'll be back. Don't go anywhere.